Hey mama, are you feeling nervous about tearing during childbirth? Because if you are not alone. That is a big concern that mamas have when they are approaching birth for the first time. But in this video, I'm going to be sharing with you why you shouldn't be afraid of tearing during birth and why vaginal tearing isn't what you think it is. I'm Bridget and I'm a birth doula in the San Francisco Bay Area, and I love helping moms love their birth. If you are new to my channel, don't forget to subscribe, hit the little bell so you don't miss any of my future videos. So one of the big concerns that mamas bring up to me about birth is tearing. Now, I've done a whole video talking about how you can prepare your vagina for birth and to prevent tearing, and we talk about vitamin E oil, we talk about primrose oil, we talk about perineal massages, and those are all great ways to prevent tearing in birth. So you should definitely check this video out here, and it talks about all of those ways that you can prevent tearing in birth. With that being said, however, tearing during birth is actually very common, and most women will experience a tear of some sort during their birth. But it isn't something that you should get hung up on or be scared of, and in this video, I'm going to be telling you why. Knowing this information that I'm about to share with you is going to be so beneficial in eliminating this specific fear over birth and bring you one step closer to having that empowering, beautiful birth that you are wanting. So first of all, when people talk about tearing, what are they talking about? Tearing usually is going to take place on the perineum, which is the area of skin between the anus and the vagina. Sometimes when people are talking about tearing, they're also referring to small abrasions that are inside the vagina that will require some small sutures as well. Now, I said at the beginning that tearing is a pretty common occurrence when it comes to birth, and guess what, mamas? Almost 80% of women experience a tear of some sort during birth. So yes, the bad news is that the chances of you tearing during birth are a little bit high, but the good news is it's something that you should not and do not need to be afraid of. So you're probably asking yourself the question, why shouldn't I be afraid of tearing? Well, first of all, it happens so frequently, but moms are still having babies. So what does that tell you? Does that maybe tell you that tearing isn't quite as bad as women often believe it to be? Yes, that's exactly it. Most tears that happen in birth aren't ones that are very severe, and usually they only need minor tending to, so they aren't as bad as often women imagine them to be. In fact, if women have torn during birth, most of them don't even know that it happened because one, they are so overwhelmed with joy and happiness and relief that their baby is finally born that they don't have time to think about anything else that's going on. And the second reason why most women are totally unaware that they've torn during birth is because of their natural labor hormone and also the natural painkiller that their body produces called oxytocin. At the moment of birth, oxytocin is flooding your body in ways that you've never experienced before. And so that natural painkiller is totally cutting off the sensation of, that tear that you've possibly gotten, and is allowing your body to bond with your baby and telling your milk to come in, and is just creating this beautiful moment with you and your baby. Another reason why you shouldn't be afraid of tearing during birth is because natural wounds in the vagina heal so well and so quickly. So I said a natural wound in the vagina, and what I mean by that is the natural tearing that may occur when baby emerges from the birth canal due to stretching of the vagina. And those are very common and those are very natural, but sometimes doctors will notice that, hey, maybe mom's already going to tear a little bit because of the baby's head, and so we're just going to do an episiotomy where they make a little incision to help baby's head come through. And oftentimes those are going to be more difficult to heal because it was an artificial wound and not a natural wound from the baby. The reason why the vagina is such a great place for natural wounds to heal is because there's so much good blood flow in the vaginal area that it really just allows those wounds to heal quickly and effectively. Oftentimes within a few weeks and definitely by a few months, you're not going to even know where that tear was. Sometimes you'll be able to see the scar on your arm or on your knee, or you'll feel that scar tissue. But because the vagina heals so well, you're not even really going to be able to pinpoint where that tear happened. So those are all reasons why you don't need to be afraid of tearing during birth. So many women experience it. They're still having babies. Your body is flooded with oxytocin so that you're going to be able to be overwhelmed with relief and joy from your baby, and it's your body's natural painkiller, and vaginal wounds heal so well. Now, I said earlier that most women only experience mild tearing during birth, and that's most likely going to be the case when you are helping your body birth in an effective way. The best way to help prevent any severe tearing or any tearing at all is to breathe correctly, and I have a video all about breathing during labor. I'm linking that up here, so definitely check that out. Be practicing your breathing, practice during birth. It's really going to help you, especially during that birthing stage, to help you avoid any tearing or especially avoid those severe tears. There are also birth positions that you can be in that will really reduce the risk of a severe tear. The big one that you want to avoid is laying flat on your back. You're working against gravity and it doesn't provide an optimal opening for baby. And so that is a big one to avoid doing, but I will be making a video all about birth positions for you. And so be on the lookout for that. And choosing the right position can really help you avoid those tears. Also, there are things that your midwife or doctor can do while your baby is crowning to really support that perineum. And so talk to them about what they can be doing, what you can be doing during the birth to prevent any of those severe tears. So to wrap it all up, mama, tearing may or may not happen to you, but it definitely shouldn't be something that is holding you back from enjoying your pregnancy and the expectations of birth. It is something that shouldn't be holding any power of fear over you. Knowledge is power, and so I hope the information that I've shared with you about tearing in this video is helping you feel a little bit more empowered as you approach your birth experience. Thanks for watching, mama, and I'll see you next time.